before Delta, the vaccines were considered, 95% effective in preventing illness. And the 5% had a very low chance of serious illness. Before Delta came around, we saw essentially 0 patients who were fully vaccinated who were critically ill. We're seeing a few sporadic cases with Delta, so the overall protection isn't as good. It still greatly increases your odds, even if you're not boosted. It greatly increases your odds of not having a severe illness, not ending up in the hospital, particularly not ending up in the ICU, on a ventilator, or dying. But the Delta variant has changed the calculus, where we are seeing breakthrough cases that aren't hospitalized. We're seeing rare breakthrough cases that are hospitalized, and very rare cases that end up critically ill. The data would suggest that getting boosted after 6 to 8 months will improve the efficacy, cut down on asymptomatic cases, the mild cases of breakthrough, and more importantly, cut down the risk of hospital admission, ICU admission, being on a ventilator, and death. So it's really a combination of a more contagious variant and a variant that requires higher levels of antibodies to prevent infection and waning immunity, 6 to 8 months after that first 2-shot series. We need this third shot to kind of, wake up that memory that our immune system has to kind of give us, once again, higher levels of antibodies that we need for Delta. The most important thing is we need to attenuate illness and transmission as much as possible to try to get through the pandemic before we have the next variant that might be more problematic.